We're reporting a sub-analysis of a phase 1 study that we have completed recently. It is very well known that antibiotics may impact the outcomes with immune checkpoint inhibitors. And in a retrospective analysis that have been completed in Japan, they found that the patients who took CBM588 after antibiotic use had prolonged progression-free survival compared to those who did not use CBM588 or who did not take antibiotics for any other infectious reasons. And in this study, we wanted to look at the antibiotic resistance patterns from baseline to week 12 in patients enrolled in our phase 1 study. For a quick detail about the design of that study, we enrolled 30 patients with metastatic renal cell carcinoma, clear cell and sarcomatoid histologies, starting treatment with nivolumab and ipilimumab, and 20 patients received nivolumab, ipilimumab with CBM588, and 10 patients only received nivolumab and ipilimumab. The correlative study is looking at gut microbiome composition, gut microbiome function, and circulating immune cytokines show that there is a shift towards improvement in immune response, and there is a shift towards improvement in gut microbiome function. And the clinical outcomes were actually pretty interesting. We have seen a remarkable increase in progression-free survival and response rate in patients who took CBM588. So looking at these stool samples collected in that study, this time we analyzed the antimicrobial resistome. In this report that I have presented at ASCO, we reported that there is a decrease with CBM588 in antibiotic resistance genes from baseline to week 12, and there is no change in the nivolumab ipilimumab arm. And this decrease with CBM588 was even more pronounced in patients who had response to CBM588. We also looked at different antibiotic types and the resistance patterns associated with them, and we found similar results. There is a decrease in the resistance genes against fosfomycin, vancomycin, rifampicin, very commonly used antibiotics in clinical practice, and the decrease is even more prominent in patients who responded to treatment with CBM588. So we think this is the first study looking at resistome in a cancer oncology setting, and with the data here that we present, we think that we are able to provide some mechanistic insights to what have been shown in a study in Japan in retrospective setting in non-small cell lung cancer patients. So further studies are going to be done in the lab looking at mice taking antibiotics after followed by CBM588, and we'll see whether antibiotics priming can improve outcomes with CBM588 in renal cell carcinoma.